So someone reached out just a couple days ago. Last week, I think it might have been Friday or Thursday, and they said, "Hey, Sandy, I don't know if you've ever done morning show on anxiety and ways to, just bring about a little bit of relief if you're suffering from stress, anxiety, mental health issues." And I think that a lot of us recognize, particularly during COVID, that there was a lot of that happening, and people were, particularly, I guess, vulnerable to these types of things. But we kind of put it to the side and moved on. But the people who are suffering obviously have not moved on. So I think it's an important topic for us to always keep in mind as being extremely relevant. So we do have Shamari Scott, who's joining us this morning, Chief Business Officer at Health City Cayman Islands. Good morning, Shamari. Welcome to the
Good
program.
morning, Sandy. Good morning, Cayman Islands. Great to be here once again. And
Yes,
and just to
absolutely.
mention that and obviously you give me the heads up in regards to the topics, but we have a great team back at Health City,
Yeah.
and want to give a shout out to Miss Kifra, who is new to the team but is always on it, always able to speak to the doctors, always able to get the topics, provide the briefs, and
Mhm.
provide all of the graphics that you need to show throughout the show. So definitely a great addition to the team, and a big shout out to her as well.
Yeah, she does a fantastic job. So we also have Dr. Diwakar.
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 Yeah, Diwakar.
Okay, Diwakar. Sorry, Sharma, who is
Yeah.
joining us this morning. Good morning, Doc. How are you?
Good morning. Good morning to both of you. Pleased to be here.
Yes, thank you so much for joining us. So this is quite an important topic. Again, I was talking about, during COVID, I think we sort of collectively recognize that a lot of people are struggling with mental health issues, especially your kids. Their schedules and lives were interrupted like nothing else, but also adults. A lot of adults, I was thinking about, the fact that this is really was the first major pandemic episode that we've lived through. Unless you're a senior, you probably wouldn't remember some of the other ones. But this was kind of tough for a lot of people. And here we are now looking at Mental Health Awareness Month. But we've come out of COVID slowly. But I wonder, based on the messages that we've been receiving, how many people are still struggling with some mental health concerns. Do you have a fix, doctor, on what we're looking at here in the Cayman Islands? How many people do you think are struggling from, whether it's anxiety or something a bit more serious when it comes to mental health disorders?
Well, I wouldn't have the data for the whole of the island, but I can
Hmm.
speak for myself, the kind of patients that come and see me,
Hmm.
especially after the COVID and still continues to the date. Uh, it's predominantly almost 80 to 90% of my people
Hmm.
uh, who still are struggling for one
Hmm.
reason or the other. And somehow COVID only made it worse for them. COVID did trigger it for a lot of people, but I would say that most of them were vulnerable to that situation of
Hmm.
being secluded and limited and inhibited by the circumstances of that time.
Hmm. Wow. And what makes people vulnerable to maybe having an episode when something like a pandemic happens, a divorce, a death? Are there some things that you tend to look for that might make someone a bit more likely to have mental health issues?
Always, I mean, that is the understanding of most mental illnesses that they start with some sort of a predisposition,
Mm-hmm.
which could lie in your genetics, it could
Mm-hmm.
lie in the way your upbringing had been. It could be about the kind of job you have been doing for a while now. It could be
Mm-hmm.
about your financial situation that predisposes you to what a precipitating factor might be able to do to you, like a COVID happening or some sort of a enforced situation that you are not really ready to deal with.
Mm-hmm.
And situations such as these, which precipitate a problem, are not sufficient enough to make it last long enough unless there's something that is perpetuating the situation. So
Right.
it's the PPP of the problem that we look for.
Mm-hmm. Right. And so we should, even when we're thinking about ourselves, because, a lot of times we can recognize perhaps that we might need some help as well as those around us. We need to understand that sometimes it creeps up a little bit. So it's just a matter of recognizing that you need help and then knowing, of course, that help is actually available to you.
That's right. Uh, any day, that's true. That we have to be self-aware about our shortcomings, our possible fallings. So yeah, you're right.
Hmm.
And Sandy, forgive me, but I didn't jump in with introducing who Dr.
Oh,
Diwakar
yes.
is,
Oh, my gosh.
and he's been with us for it seems like a long time now because
Yes.
COVID fast forwarded a lot of things, but in other instances, when I look back to see when he joined us, I was like, what, 2018? But the 3 years that we were going through COVID is like a snap, right?
Oh, yeah. Trust.
But Dr. Dwaka has over a decade of experience, and he specializes in various subspecialties, right? So whether it's alcohol de-addiction, drug de-addiction, tobacco de-addiction, depression counseling, psychological counseling, and also schizophrenia types of disorders. So Dr. DeWalker does many different things, but those are the areas that really interest him that he also subspecializes in. And even when you look at, for instance, Sandy, we're always talking about holistic care. When you
Hmm.
look at our bariatric program or our weight loss program, we have various times where we would bring in Dr. DeWalker to make sure that the person is in the right state of mind to be able to the person's doing it for the right reasons, and will be able to continue afterwards. And
Hmm.
he's a part of that holistic care to ensure that people are the right candidates and gives us the best probability for success on the back end, just as an example. But
Hmm.
Dr. DeWalker is a great addition to the team back in 2018. And even if patients come in for other ailments and they're in front of an orthopedic physician or a general surgeon, and they start to mention another area that may be concerning them, then we're able to get them over to see Dr. DeWalker if they agree and if it makes sense, and he's able to see them as well. And that's why it's always great to have so many great specialties under one roof, in that the human body, if something is wrong, many times it's not just one thing. But
Hmm.
we're able to identify and then bring in the different subspecialties to be able to look at, make sure that we cure the entire human per se versus just one specific part. So huge thank you to Dr. DeWalker for all he's done. And he came in just in time, because when the pandemic happened, especially when we were in lockdown, Health City didn't stop our work, and we were able to create all of these virtual videos and such that we were pushing through social media. And as you
Hmm.
were mentioning, mental health was such a big component of it. And Dr. DeWalker, we must have had like 8 different videos talking about the various aspects of how, for individuals who may not have dealt with those levels of stress previously, how to deal with it to make sure that we didn't have more issues on the back end. So a huge thank you for Dr. DeWalker for that as well.
Hmm. Absolutely.
Thank you. Thank you,
Um,
Shumari.
Yeah, no, it's I think it's amazing the availability of experts at Health City Cayman Islands, because quite frankly, sometimes we just think of one or two areas of specialty, but wow, you've got it fully covered there, Shamari, with all of the physicians and support staff, which I think is fantastic. So this morning, folks, in case you just joined the program, we're talking about mental health awareness month. Very, very important topic. Feel free to call in 936-2626. We all suffer, from different things when it comes to mental health and awareness. And of course, like any other topic, this is a disease. This is disorders that can be treated with professional assistance, and there are things that can be done. And look at that. We got a call already in the program. Good morning, caller. Welcome to the program.
Good morning,
Yes,
boys.
good
And
morning.
I just want to say I was literally just talking to my partner in regards to mental health
Mm,
and saying it's something that I feel passionate about getting into,
yes,
is even
absolutely.
to provide a form of support. And I, I think one of my biggest concerns
Mhm.
is the younger community's reaction to someone going through something that's traumatic,
Mm,
or that sometimes we're even self-aware and we reach out to someone, or we're
Mm,
self-aware and we're afraid to reach out. And that's one of
mhm,
the biggest causes of mental health. Sandra, I really um, enjoy your shows, and you have
mhm.
been bringing up some topics that are really passionate to me. So I really appreciate it. So continue to
Yes.
do the good
Thank you
job.
so
Okay.
much. Yes, thank you
All
for
right.
that amazing comment. Thank you, sir.
You're welcome.
All right, folks, 936-2626. I don't want us to shy away from this topic because, again, a lot of us might think we're coping. Well, we may or may not be. Dr. Diwakar will certainly give us some suggestions and things to look out for here this morning. But let's not be shy about any topic. No topic is off limit here. Health City Cayman Islands brings all of the medical topics, whether it's general health care, cancers, mental health, nutrition, everything to the forefront. So this is your opportunity. If you have a question for yourself or anybody else, please do reach out this morning. You can WhatsApp me, of course, or you can also call the program. So what exactly is mental health? So perhaps having a good understanding, Dr. Diwakar, and what that is would be helpful.
So, of course, like any other discussion about physical health, we often miss out on what mental health would mean.
Mm-hmm.
In general, the idea of being in health is absence of disease and disabilities.
Mm-hmm.
And that holds true for mental health too. It's a state of being mentally well. Uh, when we say mentally, what we are specifically trying to talk about is the way we think about things, the way it makes us feel, and how that influences our behavior.
Mm-hmm.
It's a web of these, predominantly these three things that we utilize to understand what mental means, and rest of it is obvious when we say health.
Mm-hmm. Very good. So, of course, let's talk about why it's important. So, there's a number of things here that we need to be looking at. The suicide rate. I know that this is something that has come up amongst children in particular, but also adults. Has increased as a result of COVID. I saw some statistics recently relating to the mental health of our children that I thought was really quite shocking and surprising. So let's talk really, about what are we talking about here, especially with adolescents and younger people.
Yeah, so this has been really a very concerning thing in last few years, almost a decade now, that we are
Hmm.
seeing a pattern where youngsters are being noticed to be more vulnerable to suicidal attempts as well as completed suicides.
Mm,
This pattern seems to be catching up not just with the developed part of the world, but also developing countries too.
hmm.
So it's a statement that we do need to talk about. We do need to put it into the mainstream discussion and open our eyes to the vulnerabilities our younger generation is facing.
Hmm. Hmm.
Uh, the stats look scary when we say that suicide is the second leading cause of death among 15 to 29-year-olds. The first reason is probably the road traffic accidents, but the
Hmm.
second reason is scary to be suicide.
Hmm. Yes. Wow. Quite shocking, really. And again, it's a conversation that we have to ensure that we're not afraid of. Mental health conditions increasing around the world. So we see that between 2007 and 2017, there's a 13% rise in mental health conditions and substance use disorders. Any idea what's fueling the increase?
Uh, there could be several factors that could be specific to a particular place or country,
Hmm.
but in general, there is a rise in social pressure. There
Mm,
is a rise in access to situations and substances, which make it harder for one's mental health to stay stable.
mhm. Hmm. Really shocking. And I think that for children in particular, social media is one of the things. We're going to look at some of the causes here, but social media is one of the things that I don't know if it causes mental health issues, but it certainly can exacerbate it and really put children under a lot of undue pressure. So let's look at some of the known causes of mental health. So we've got everything from family history straight down to grief. So let's talk about some of these specifically.
Yeah, so as I was mentioning earlier, The causes could be classified, or the pathogenesis, how a mental illness starts to happen. It starts right there from our genetics, the kind of genes we have received from our parents.
Mm-hmm.
We do carry certain vulnerabilities as a population or as a part of being victims of trauma,
Mm-hmm.
uh, which our parents or their parents had to endure. The remnants of it do pass on through our genetics.
Mm-hmm.
So there are
And
in fact
can I
very.
pause you right there, Dr. Diwakar, because I've talked about this on the program before, and I'm not so sure that it's really like sunk in for people how trauma in particular has the ability to be encoded on your DNA, and it's passed on from literally, as you just said, from one generation to another. So when you've had really big traumatic events like the Holocaust, like slavery that lasted hundreds of years, and you see, African American people struggling with all sorts of issues. I think that when you put it in context, that what your ancestors went through, not just a singular traumatic event, which can be enough to impact the coding of your DNA, but hundreds of years from one generation to the next that has embedded on your genes, and so it changes who people are. It changes the genetics of an entire race of individuals, and I think that that shouldn't be dismissed because it can explain a lot of things that we see, even in the wider context of we've got politicians and policymakers and the civil service. They're looking at ways to address criminality, to address antisocial behavior, and all of these things. But if they're trying to address all of that without acknowledging the source of some of the issues at the very least, then how much can you really hope to achieve?
Yeah, you're right. I think the problem is that we are in a hurry to make sense of things, and we
Mm,
may try to use what is visible to us right now.
mhm,
Uh, Whereas most of the problems we are facing today are consequences of things that have been going under the surface for a long, long time.
mhm. Hmm. Very, very true. All right. So we've got some other causes here that we're going to look at. So biology. What do we mean when we say biology?
I think what it means is that how our body is shaped through our experiences.
Hmm.
Uh, since we talk about this idiom that the body and mind is one and same. So anything that influences us, like infection, certain infections which mothers have can be changing the way the body reacts for the child as they
Hmm.
grow older. Certain other afflictions, even if it's not an infection, certain illnesses predispose one to have more mental illnesses, for example, epilepsy
Hmm.
or multiple sclerosis or any chronic illness for that matter, makes
Hmm.
you more vulnerable to have more mental health problems.
Hmm. Very interesting. Childhood trauma. Wow. Wait a minute. I've just skipped a history of abuse. Let's not skip that one because I think that's really, really important. A history of abuse, and I feel like childhood trauma could probably go a little bit hand in hand. But what specifically are we talking about for those two?
I think we did touch upon indirectly on that, but it makes sense to be specific about it. That childhood experiences, that's a formative stage for adulthood and the rest of our lives.
Hmm.
So the impacts really resonate throughout our lifetimes if it's traumatic one. It changes the way we learn to react to situations. It changes the way we learn to read situations,
Hmm.
which leads to further complications and accumulation of more and more issues.
Hmm. And if I can sort of expound on this bit a little bit more, because I'm always pushing for, I'm a parent myself now, but even before I was a parent, I was always pushing for, parents and members of the community to sort of think outside of the box when it comes to disciplining children and looking for a more gentle approach to disciplining. We talk about, for example, the 10 adverse childhood experiences which we know have a significant impact on the development of children into young people and into adults, and what some of the remnants of that will do long term implications for their entire lives. So what do you say to parents who are perhaps listening to the program and thinking about what is it that they can do when it comes to their methodology of child rearing? How can they impact their children in a positive way, knowing that these adverse childhood experiences are something that they carry with them their entire lives? They're called ACEs. Everything from physical abuse, obviously sexual abuse, emotional abuse. And emotional abuse there's a wide gamut of examples of that, from belittling your children, rejecting them, ridiculing them. Like I see people doing this all the time where they make fun of kids, and they change their voice and they mimic them, blaming, threatening, isolating kids, restricting social interactions, even denying the child an emotional response, or purposely not talking to children for extended periods of time.
Yes, you're right. That's very common behavior amongst parents. And I believe that it's mostly driven by a desperation for something we want our kids to be better about.
Mm-hmm.
So it's this intervening stage of feeling desperate to get results out of our kids, as if a lot is on stake in that moment when we are behaving that way with the kids,
Mm-hmm.
punishing them indirectly or directly. It's an indirect punishment that parents withhold themselves from not talking to them, or going on the other side of the spectrum to be even abusive.
Mm-hmm.
So they do have impact in a long in the long term of things for those kids.
Mm-hmm.
uh, One thing that parents should need to understand is that this is not the same time as we or their parents might have grown up, and the way we were parented becomes a template for us to utilize in
Mm-hmm.
parenting our kids. It's a different world, and we have a better understanding, and we are better versions of ourselves, I believe.
Mm-hmm. Mm-hmm. Yeah.
So
And ultimately we should be aiming to improve upon whatever our parents did with us. Nobody gets this perfect handbook on how to raise children in an imperfect world, right? So you learn as you go along. Obviously every child is different, every situation is different, but I think ultimately the goal is to try to improve upon whatever may have happened in your past. And there are times that we just don't know how to do that. So if someone comes to you, doctor, and they're looking for like practical advice on how to, move past their own trauma. Because a lot of us are walking around with baggage, so to speak, right? We have our own trauma that we've kind of like, swept neatly in a corner, and we try to think, oh, we can forget about it. But there are times when it seeps up in our relationships, in our interpersonal relationships, how we relate to our children and other people who are very, very close to us. They get to see the remnants very, very clearly of the trauma. So, what are your recommendations for parents or people in that situation? Is it best that I come and unpack my own trauma, get therapy? Is that really the way to then move forward and have more meaningful and productive and engaging personal interpersonal relationships?
I agree with you that there's a lot of trauma and baggage that people carry. But I do also believe at the same time that having a baggage is inevitable, unavoidable, because it's the way we are wired.
Mm-hmm.
Unless we make something so important that it hurts us, we can't just get better at it. It's the way we conduct our psychology.
Mm-hmm.
Um, but when people come to me, and the most important aspect of it is that either they have successfully accepted that they have a baggage and an issue from the
Right.
past, or it's pointed out to them with a
Mm-hmm.
professional helping them, or a friend maybe. It's not about the person who's helping. The fact that you're able to identify, that's the first step.
Right.
And after that, things become a relatively easier.
Mm-hmm.
So in that process, if someone is not able to do it on their own, then yes, professional help is definitely advisable.
Mm-hmm. Hmm. Very good. Unresolved conflict, I guess that's pretty much what we were just talking about there. Long-term stress, social issues such as poverty, debt, illness, grief. So let's talk about the social issues, because I think this is also important. I know that there are a lot of policymakers who do tune into the program and they listen. How do social issues contribute to mental health issues?
Well, one of the biggest social issue we already touched on in the form of COVID,
Mm,
but the kind of social issues that resonate with most people are related to their social network, the kind of people they have to sit and breathe and live with, the environment of finance, the environment of relationships, the environment of profession. Uh, in general, bigger political issues do indirectly contribute to an individual's mental health too.
Mm-hmm.
So it's a contribution from different directions for different people. Some vary more for them, some weigh more in their mental health problems, some weigh less. So I guess it's a very individual situation
Mm-hmm.
that looks in-depth analysis, individualizing it.
Mm-hmm. Hmm. Super interesting, folks. 936-2626 is the telephone number. We're talking about mental health issues. If you struggled with something, feel free to call in and share. I feel like we all have. And part of the way in which we can relate to each other, we can sympathize with each other, empathize with each other, really, is sharing these collective stories of mental health and grief and, things that at some point most of us will experience, illness being a big one. We have an aging population. And sometimes, as caregivers, it's the caregiver who's going to undergo quite a bit of stress, but also someone who might have, doctor, a physical ailment that their mind is aware of, what the body is going through. What are your thoughts there? I can automatically, a few friends and acquaintances come to mind who I know. For example, there's an individual who's living with a disorder that will eventually take his life, and this is something that every time I see him, he talks about. The doctors have said, okay, put your affairs in order. And he's got children, he's got a wife, he's got a business, he's got all these things that he has to keep afloat, and he's thinking about what the eventual passage of his life will mean to all of those individuals.
So this is for people who are struggling for long term.
Mm-hmm.
It makes sense for somebody to understand why they will struggle mentally also,
Mm-hmm.
because of the length of time they have to deal with and cope with adverse situations.
Mm-hmm.
uh, Illnesses that long last in our bodies, they do also change the way our brain works, and brain is the seat of what we think, how we feel. There's a stronger lobby of scientists, it's getting stronger day by day, who believe that inflammation is one of the reasons why people get depression,
Mm-hmm.
with whether they have a long-standing illness, or they have no overt illnesses, but some
Mm-hmm.
sort of inflammation is continuing to happen in their bodies, and the mediators of that inflammation biologically do trigger them for having mental issues at some point.
Mm-hmm. Hmm. That's very interesting. I had a young lady not too long ago confide that she suffers from depression, and she was talking a little bit about how that impacts her life and how people are kind of like, in this community in particular, they're like, oh, just pray about it, it'll go away. Or, think positive. Like people think it's so easy when they say things like that, that's going to just make your mental health, whether it's depression, bipolar disorder, other things, it's just going to make it go away if you pray about it. Like God will solve all of your problems. Or if you think positive, positive thinking has the power to just make what can be a biological or chemical imbalance just disappear on its own. What do you say to those of us who have people in our circle of friends or family who are dealing with mental health disorders? How should we be responding to those individuals?
First of all, the response should not be out of obligation that we have to say something or react to it. I
Mm-hmm.
think when someone is willing to open up about their struggle,
Mm-hmm.
they are coming from this place of just letting themselves out, not closing themselves in.
Mm-hmm.
So sometimes being receptive is the only thing that we need to do. You do
Mm-hmm.
not have to be reactive or judgmental. You just
Right.
have to listen quietly.
Right.
And if you read the room and understand that the person wants you specifically to do something about it, and it is within your power to do it, why not?
Mhm.
Um, Talking about religion, being in a positive state of mind, all those things are helpful to some extent if this issue is not severely pathological. Like
Mm-hmm.
if someone's going through a milder situation and it is not influencing their lifestyle or their ability to function so significantly, then these could be good advices, but the other person should be receptive about that advice. That's crucial.
Mm-hmm. Hmm. Super interesting. So again, folks, don't be shy. 936-2626. We do have a comment here. Miss Lucille, thank you so much for this. Miss Lucille says, "Good morning, Sandy, and all those doctors. I'd love to know. They have a mental health service there at home. Mental health can be a chronic disease, and it does not give you warning. Sometimes you don't know when it hits. When it hits you, I can say it is not a good feeling. You get different thoughts in your head. At times, I know stress is one of the main sources. If I am wrong, I would love the doctor explain to me." So, she's talking about some of the causes, and we were going to get to this one here about grief. Is it possible? I guess it is, when you think about grief, for a singular event to really be the trigger for an individual's mental health episode, right? So grief is a big one. I mean, my gosh, you lose a loved one, and it's like you feel like your life is just spiraling out of control, right?
Yeah, there's no doubt that there's nobody in the world who hasn't lost a loved one.
Mm.
And we do sense the feeling called grief at least once in our lives.
Mm-hmm.
So it's a normal reaction to some extent for all of us to have. In fact, if we don't have a reaction, that's more pathological. So yes, you're right in saying that grief does have a significant role to play. If someone is vulnerable, it can really lead you into bigger problems.
Mm-hmm.
But it is rare to see people who do not have vulnerabilities, who do not have a history of issues. Uh, they do well, even despite of losing someone they loved and cared for. Getting working through the grief, uh, it's a sign of being healthy.
Mm-hmm.
Going through grief is not unhealthy, but getting through it, that confirms the mental healthy state they are in.
Mm-hmm. Hmm. All right, let's look at some symptoms then, because I'm sure we're all sitting down thinking this morning, how do I know that someone is, having a mental health episode, something that I might be concerned about? So some of the signs and symptoms you might recognize in yourself: feeling sad or down, inability to cope with daily problems or stress, confused thinking, excessive fears or worries, excessive feelings of guilt, major changes in eating habits. That's super interesting. And extreme mood changes, highs and lows, and withdrawal from friends and activities. Doc, anything that we can say specifically in relation to some of these symptoms?
Yeah, so pretty much most of them are explanatory on their own.
Yes.
Uh, but I think what we are trying to generalize here are the more general problems that people often pass on as something trivial.
Uh-huh.
Uh, it's easy to just say that I'm feeling sad today. It's okay. Let me just give it some more time. And even after some time, you feel that now it's been so long that maybe this is the new normal for me.
Mm-hmm.
So those people are not able to identify the impact it is having with each passing day on their ability to function as
Mm-hmm.
a professional, as a family member of other people, as a friend to somebody, or as an individual of all the things. So it's very important to understand the contrast of how one was functioning versus how they're functioning now if they are having any of these symptoms.
Mm-hmm.
It is an indicator of the severity of the symptom, that how much impact it causes in their ability to function.
Mm-hmm.
So all the symptoms mentioned here, one of them also talks about stress, as Miss Lucille was also mentioning. If we can take that up here right now.
Mm-hmm.
So yes, stress is a big reason these days that comes into play when we are struggling mentally. Um, Stress is also a kind of a reaction to adverse, unexpected situations.
Mm-hmm.
We are bound to get stressed if we are going to appear for a very important interview,
Mm-hmm.
or we do have an exam coming up. We are supposed to react to it in the form of stress. Now, stress has various components. Major two components are that our body has a biological reaction to it, and we have a psychological reaction to adverse situations.
Mm-hmm.
So consequently, stress is physical and mental.
Mm.
Uh, the problem doesn't lie with acute stress, as we do have coping mechanisms to deal with psychological stress, and
Mm-hmm.
our biology also has its own mechanisms to deal with it.
Mm-hmm.
But sometimes experiencing these symptoms physically or psychologically, it sort of uh, creates its own problems. Like, for example, people, when they get scared, their heartbeat starts racing.
Mm-hmm.
They feel uncomfortable in their body. They start trembling for a moment.
Mm-hmm.
They might forget about what really triggered it in that moment, or they might remember it. But this experience rattles them more. It
Mm-hmm.
makes them more vulnerable to question that something's gone wrong right now and I don't understand. I felt as if I'm going to die. It could be a serious heart related problem, or other physical problems, but then they of course go to a doctor and realize that their heart is just fine. They're as healthy as one can be at their age. So the possibility of panic disorder or panic attacks is going
Mm-hmm.
to come into picture. That panic attacks converts into a more lasting anxiety because you don't have answers to a problem,
Mm-hmm.
answers that you're willing to accept, answers which make more sense to your understanding.
Mm-hmm.
So people live with that anxiety and fear for a long time, that they can have a panic attack anytime. So gradually it converts into restricting your field of restricting your ability to go out in public places because you're uncomfortable there, and you don't want to feel uncomfortable because it resonates with the fear of having more panic attacks.
Mm-hmm.
Then that's how a problem converts into a different problem and then leads to a different problem. Long lasting anxiety states, they make you vulnerable to have depression eventually.
Hmm. Wow. I want to ask you a question about sort of panic attacks and anxiety. I've never really suffered from that. I've noticed like a panic attack, but I do have a little bit of anxiety right now that's going on because it's kind of a I don't even know how to I know how to explain it, but I've got a new dog in my life, and I lost my other dog because of some dogs next door, and unfortunately I witnessed the entire thing. It was very, very traumatic. For me, dogs are family, and so it was very traumatic to actually have been there when her life was taken from her. It was a very violent situation. I've never witnessed anything like that. You feel like in the moment as it was happening, I literally felt like I was going to have a heart attack. I mean, I was just besides myself. On the one hand, I was trying to save her life. I was trying to get these dogs off. I was just like a total mess. And now we're going into 3 years. I've finally been able to bring myself to, okay, let's get another family pet. But those dogs are still next door. And I find that even my daughter has kind of said to me, because sometimes I accidentally call this dog the old dog's name. I'm still trying to get used to all this, but um I find like I don't want to walk down that side of the street. I am like hyper alert every single time. Even talking about this right now, I can feel like my heartbeat has gone up a little bit. I don't want, every time I go outside I'm like looking around, like I'm just worried of a repeat incident. And I know that I'm having to walk my dog. She's still potty He is potty training, so this is like 6 times a day I'm taking this dog outside, and every time if I go out front and not in the backyard, I'm thinking about this incident. Like it's constantly in my mind, and I'm worried that they're going to get out again. And I'm just like, I feel like I'm having some sort of anxiety over the whole thing. In a situation like that, where I know exactly, what's causing it, where it's coming from, short of going over there and murdering dogs, what can I do to kind of help with this situation? Is this something that I really need to come and see you as a professional about? I feel like I have a good grasp on what's causing it, but I can't really control the thoughts that are in my head as it relates to just a fear. It's like an overwhelming fear that this is going to happen again.
So acknowledging in that moment that you're experiencing something that's a response to what you endured for so long now. It's become a condition now that whenever you find yourself in the situation close to that side of the fence, or when you're with your dogs, your brain just triggers that response
Hmm.
that's not feeling comfortable.
Yeah.
Your anxiety is driven by that circumstance and situation, and it's just limited to that, I guess.
Yes.
So you need to draw that line that it's actually related to what you had experienced,
Hmm.
and it's not unjustified to feel that way in that circumstance. But if this fear anxiety becomes so immobilizing that you stop walking your dog, or stop training your dog, or stop having dogs,
Hmm.
then I would say that this is so pathological that it requires intervention.
Yeah, yeah. I mean, it's crazy. It makes me emotional, even now, talking and thinking about it. So I haven't stopped walking the dog. I just do it. I know that I have to do it, but it is quite an emotional situation. And so Miss Sue here is dealing with a situation that I think a lot of us have experienced to some level. Her husband of some 50 years passed away recently, and she's having to deal with that. So she says, yes, I'm going through grief, and it's so hard every day. I miss my hubby so much. I have to take every day as it comes, some bad and some better. Thank God for my daughters and grandchildren who keep me going, as life for me now is so lonely and sad without him. Everybody's so busy with their lives and they all forget. And I pray for God to give me strength to carry on every day. So when it comes to grief related, you know, depression or just grief, just dealing with grief, which can cause things like anxiety and other mental health disorders as well. What's the best advice? Is it good to try to join like a support group? I don't even know if we have a grief support group here in Cayman, but are those things that people should be looking at doing?
Of course, I mean, enduring it all by yourself, unless it's a necessity, I wouldn't advise anybody to be closing themselves from social connections. It is always a good idea to identify and remember the loss. Try to have more positive memories about that person. People usually, in general, are kind. I hope and pray that she is also finding that kind of a support around her. But yes, grief, we need to understand that none of us is trained to entertain the possibilities of losing someone that we cared for, we loved. So we are trying to figure it out. And the process of figuring it out, first of all, the loss, and then how to be in this new reality, that's the
Hmm.
process of grieving.
Hmm.
So support definitely is required in that process.
Hmm.
And yeah.
Yeah. So when we talk about anxiety disorder, here you say that's very common and it affects an estimated 264 million persons around the world. That's quite something. Tell us, how do we know that it's anxiety disorder? What are some of the things that we're looking for?
So, to just further the conversation we were having about anxiety earlier, stress induced and otherwise, anxiety is a normal reaction to situations that we never anticipated, or if we anticipated, but it doesn't seem to be going that way. The anxiety is a normal reaction, but if it starts being so intrusive, the worries become so widespread and present all the time that you can't function. You are having thoughts about that one thing that's bothering you, even when you're working on something else.
Mm,
That interruption of our abilities, it becomes kind of a line that if it is being breached, it's a disorder. It's a
mm,
disorder, and you need to do something about it.
mm,
So, usually, anxiety disorders are characterized by intense, excessive, persistent worries and fears. And it is not something that's specifically for some people. There are different kind of anxiety disorders. Few of them are limited to specific situations. Some of them are limited to, in general, all the things around us. So accordingly, they're given the names. The diagnosis are given the names of generalized anxiety disorder, or specific phobias, or agoraphobias, or different kind of phobias.
mhm,
uh, One of the most interesting anxiety disorder. It used to be classified as anxiety disorder earlier. Now it is a category of its own, but it's still anxiety is the core of that disorder, which many of us under the surface continue to struggle with. Is OCD, obsessive compulsive disorder.
mhm,
Uh, in general understanding, anybody who's too repetitive, anybody who's too strict about their things, we like to call them OCD, and it's
mhm,
okay. I mean, For
Yeah,
vernacular, it's okay.
we overuse that term a lot.
Yeah.
Yes.
I'm happy and sad at the same time that it's used,
Yes.
because at least we are talking about something, and people's awareness is better with time. Maybe at least there's a possibility.
Mm-hmm. Mm-hmm. But we should be more conscious and aware of when the terminology is being used a little bit too casually, right? So just
Yes,
because you like things neat and orderly doesn't mean that you suffer from OCD.
that's true. That's true.
Hmm. Right. So how do you know when it's turned into something a bit more than, oh, I'm just a very neat and orderly person? What sort of tips it on the other side where you might have a concern?
So there are certain guidelines. We work with guidelines from the Diagnostic and Statistical Manual (DSM-5), based out of US. There are criteria to diagnose somebody with OCD.
Hmm.
But for general understanding of such things, and that whether to call it a disorder at all or not, the
Hmm.
criteria is still the same. That whatever symptom you're calling OCD, it should quantify into something that disrupts your functioning, something that if it was not there, you would be much better.
Hmm.
So, for example, people who indulge in too much cleaning and orderly things, arranging their things too neatly, and they spend a lot of time, which could be better utilized at other things, then it's something that calls for intervention.
Hmm. So if it starts to interfere with your life, basically, then you might have a problem.
Exactly.
Yeah. All right. So we have Alejandro here. Weed is his solution to everything. So we want to get your take on it. He says, weed and caffeine helps me with anxiety and depression. I don't even think about anything that bothers me anymore. When I lost my mom, a little bit of alcohol got involved. I've diluted that to just having a beer a day. Wow. Maybe if a friend invites me for a drink or something. I think mental disorders, you need a friend or two that understands what's going on, that they become a serious moral support. I've got 4 friends, excluding family members, that reach out to me every day, and I'm thankful for them. So it's a couple things packed into this comment. Number one, marijuana and caffeine, he says, have resolved his anxiety issues and depression. What's the medical take on this?
So yes, that is still a bone of contention amongst many clinicians around the world. But in this part, we have a better acceptance of the fact that these chemicals that we find in cannabis have been helpful for many people.
Mhm.
It's just that it's kind of a lock and key that not everyone who connects with cannabis gets the same results that some may get,
Mhm.
which is true for many antidepressants too.
Mhm.
So I would say that we are still in that stage of knowing what exactly is going to work for which person in what stage of the problem. Cannabis has traditionally had a medicinal value in different cultures also. So I'm
Mhm.
not completely against it. I'm not completely in for it, if you're asking for my opinion.
Yes. And we saw just recently that there is a report that came out in the Journal of the American Medical Association, which actually saw that there's a link. Of course, that doesn't mean that there's a cause and effect, but there is a link between teens and young adults who use cannabis and actually have an increase, quite a notable increase in mental health issues. So this is quite interesting. We shared this and touched up on it on our show last week. But basically, the research has found that when it comes to teens who are casual users, their increase of things like depression and anxiety increases 2 to 3 fold. And for individuals who are considered chronic users and might actually have a problem, it's 4 times more likely that there's a connection between mental health issues and mental health disorders. So we can't say it's like the chicken versus the egg, maybe which is coming first, but mental health professionals are based on this are raising the alarm and are saying, we just need to pay attention to this and parents need to be very aware and to keep a keen eye on the situation. The research was based on more than 68,000 teens who were involved in a survey. Good morning, caller. Welcome to the program.
Yeah, to comment on that research that you found out. I mean, I don't know about that research, how true of that is to everybody, but that's maybe just one individual they were testing it on. I've known a guy when he was like 13 years old, I was skateboarding with him in the skate park when it was open. He told me that he had depression and he had anxiety, and his parents put him on a medication at the hospital that the doctors gave him,
Mm-hmm.
right? And he he was always that type of person that was almost suicidal. When I said almost suicidal, he would sit on the edge of the ramp and just keep looking down for I don't know what reason. I was like, dude, what's wrong with you? I said, you're scared to go down? You know, and he's like, no, and he start crying, he start talking about his problems, and he start doing this, doing that. And I was like, dude, just face your fears if it's something that you're scared of. I think that when it comes into certain anxieties, certain depression, is about people with fear. I understand a fear of something is what causes depression and anxiety. You know, I don't know. I mean, that's one of my thoughts of having it. The one thing that feared me the most was losing my mother. Yeah, I already lost her, so I faced that fear already a long time.
Okay. All right. Thank you very much.
Yeah.
Appreciate those comments. So facing your fear, is it just as easy as that? I mean, I'm not really quite sure. I think for everybody, maybe that means something different. But how easy is it to, Alejandro also said, which had me a little bit worried, that he's relying on some substance to try to help him, whether it's the weed, the caffeine, or the alcohol. Those are, all things that can be addictive, but he says that he's relied on those and a few good friends to kind of help him get through it. Is that the formula for success in your mind if you're having anxiety and depression?
Well, for youngsters particularly, and maybe for many adults also, I feel that many times we're trying to cope with something that we don't understand, or if we understand it from the place of fear.
Mm-hmm.
So it makes sense to them that anything that helps them feel less fearful, they will hold on to it. The vulnerabilities that we are born with, they can't be changed. Whether we use cannabis or an antidepressant, or the environment that we are born in, it can't be changed. But some certain chemicals have this propensity to affect certain people adversely. So this study that talked about making people more vulnerable to have mental health issues, I believe that people who are going for chronic use are probably trying to medicate themselves, and which calls for a better understanding of what they're trying to treat with cannabis or alcohol, or for that matter any other substance that we call recreational, if for the lack of a better word.
Mm-hmm.
So instead of being a recreational user, they turn into something like a medicine for them, and it just continues. And if there's a propensity, it just converts into a bigger mental problem.
Okay. And the idea that we should be I think sometimes it can be a little bit challenging for us if people are trying to self-diagnose, like they think they've got it figured out, or they, or self-medicating. What are the dangers in that aspect of it? Trying to be your own physician, basically.
Um, for the colleagues of my fraternity who come from other branches of or specialties of medicine, I would say that's a grave danger if you're diagnosing yourself. It could be a fatal flaw in your understanding of your problem. But when it comes to my specialty, I would always encourage people to read about it and come to me if they have doubts about it. There is no harm in calling yourself anxious and depressed, or just depressed, because it doesn't really convert into any change in intervention. Because anyone who's going to help you get better would understand how to open the layers of things. It doesn't really make too big of a difference unless someone diagnoses themselves as bipolar disorder and they don't have it, or schizophrenic and they don't have it. Until that time, I think that it's okay to really look for the boundaries of what you think you have.
Right. And of course, I mean, there's certain severe disorders like schizophrenic disorder or bipolar that you don't see it. Everybody else sees it. I mean, I've seen people even in our community here. And to me, I'm like, wow, this is a classic case of someone who's bipolar, because I've had experience with individuals close to me who were bipolar. And you see almost, for some people, it's almost like you can cut with a knife when they enter the manic stage, when they've come out of a years long depressive episode. And right away they're like, oh, I'm cured. I'm going to write a book. I'm going to do this. I can fly. I can do. And it's like, whoa, 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 whoa. And they themselves don't see it. They see it as, oh, I'm high functioning. All of a sudden I can accomplish everything that I've ever wanted to do. And a lot of people around them also just give them a pass as, oh, they're just a little bit weird.
Yeah, that's so true. The distinction that you have a severe problem is that when you don't have the insight about it. The traditional classification of mental illnesses used to be just simply calling people neurotics or psychotics, just on the basis of how much insight they have about their suffering.
Caller, good morning and welcome to the program.
Good morning.
Morning.
I heard the caller use some terminology that I'd like to have your guest talk about. He said cure. And the thought that came to my mind is, regardless of which substance you're talking about, if you're using that thing and it results in a cure, then it would mean you don't need that thing anymore, whatever that thing is called. But if that thing is still needed, then is it a cure or is it a therapy?
Interesting. Doctor, what's the difference? I mean, are you ever cured from, there's some mental health ailments or conditions that cannot be cured, can only be treated. And to Denny's point, based on what the last caller said, if it's a coping mechanism, so every day, if you're still having to drink, if you're still having to smoke marijuana, and you're still having to, drink caffeine or whatever, are you actually cured of whatever anxiety you may have, if there's such a thing as being cured of anxiety?
Yeah, so that's a limitation of language here. I think that cure as such is the right term for illnesses which come from different other kind of physical illnesses. For mental illnesses, the understanding is not so medical. It is more psychological and how we learn to react to situations. If for any reason our mind chooses to start understanding and consequently react to situations again the same way, there's nothing stopping it from doing it. So, cure is not the right term. I agree with the caller at this point, and the previous caller who was using this term. I certainly agree that cures are very hard for mental illnesses. But it doesn't mean that if you have a label associated with you, you can't get out of it.
Right.
Like the labels usually keep changing because labels are for the sake of our understanding of what's going on in someone else's head. So curing a heart disease is very different from curing someone's depression.
Yeah, absolutely. Alejandro also mentions that his mom had bipolar disease or disorder, so he's seen it firsthand. Should he be more concerned because he's had a parent that has had a mental health disorder such as bipolar? How does that impact his chances? And is it really something that he should be more concerned about? He might just be thinking, oh, I've only got anxiety, but is it possible that there could be other things going on there as well?
Yeah, so understanding of bipolar disorder does strongly stress upon this possibility that if there's somebody in close relatives, like first line blood relatives, parents, brothers, sisters, it increases your vulnerability. It doesn't cause it itself. Very early in the conversation, I was talking about predispositions. It's one of the predispositions that you have. If your life takes you in places and situations that put extra stress, that vulnerability is going to become wider and wider, eventually breaching the limits of normalcy for you. And the risk, it needs to be looked at it as such. You shouldn't live in the fear that you're going to have the same symptoms. More realistically, people who have a suffering family member from bipolar, they more necessarily go through anxiety and depression than having bipolar in their lifetime.
Okay, we do have a caller in the line. Good morning, caller. Welcome to the program.
Good morning. It's a pleasure. Sabrina Turner here. How are you?
Hey, good morning,
And to
Minister.
your
How are you?
guests. I am fine, thank you.
Good.
And I thought it was very important for me to call in and show my support, understanding that it is Mental Health Awareness Month. However, here in Cayman, we usually put a lot of focus in that at the end of the year. But more so in the US, it's looked at as for the month of May. But understanding the stigma that has come with mental health, and now the spotlight that has actually been shown on it since the pandemic, anytime is a great time to educate, inform, and to just make sure that people are aware that you shouldn't feel any less in reaching out for help, being able to identify, and just know what resources are out there for people to tap into is always a pleasure to be a part of these discussions.
Yes, well, thank you so much for that. Obviously, Minister Turner is Minister of Health and Wellness, and so this must be a very important topic under that umbrella for you as well. So we really appreciate you taking the time out of your busy schedule to call into the program today.
Yes, it is a pleasure. When you look at even what we're doing here in the public health spotlight that should be out in the public's domain this month, you will notice in that, and this is found on all of our social media pages. We focus this edition of the public health spotlight predominantly on women's mental health and children's women's health. Why? Because we celebrated Mother's Day, and we know how that is tied in to everything with taking care of kids. And we look at all of the social pressures right now. People are just grappling with keeping everything together. So it was for that reason, that we focused this edition on women's mental health and children, because we all deal with these pressures and stresses differently. And for women, we're always known as being the strong one. We mask our feelings. We just have to be that nurturing provider, but there are times that we break as well. That shouldn't be looked upon as anything of being weak. There is no weak, there's no strong when it comes to dealing with the pressures that society puts on us, that your family puts on you. And we are human beings. And I think we are on, from the Ministry of Health, we want to get nationally that culture where we engage more with the HR departments in being able to identify these, because it does impair productivity in the workplace. So this is something that we have to deal with nationally in the Cayman Islands. And as the ministry gets together, secure the necessary resources, I'm hoping that nationally we can all jump on board, and all of the services providers come together, and we can fight this together as a unified country.
Beautiful. Thank you so much, Minister. Really appreciate it.
Sure. Thank you, and I'll continue to listen.
Okay, wonderful. Now, the doctor does have a pressing schedule this morning, so we do have to let him go here. But we'll take one more call. Good morning, caller. Welcome to the program.
Good morning. I was just listening to the minister, and I'm not sure exactly what she's referring to by, everyone coming together and working together. But I do hope that means maybe laws are changed, that mental health days are given separate from sick days. Maybe that means that insurance providers it's mandatory to cover mental health therapy. I hope that some of those things come into play soon, because you could recognize that you have a problem all you want, but if you can't afford to see a therapist, you can't afford to see a therapist.
Yes.
So I really hope that things change in terms of insurance and mental health days off of work. That would be great to see those put into law, and not just, because we can talk about it all we want, but if the average person can't afford therapy, then you just can't afford it,
Thank you. That's a great point. Thank you so much. All right. Absolutely. Some really salient points here this morning. Just take a few more comments. Jackie says, a question for the doctor. Does Health City prescribe cannabis for patients? My impression is no. I have a serious surgery, but the pain medications did not help. They made me sick, nauseous, and couldn't help the pain. I checked into alternative source, which led me to prescribe cannabis that did help. It didn't help the pain as much as it calmed me down to tolerate the pain. Interesting. In the healthcare I was involved with, you can't judge someone's pain 100%. Here it seems they think you're an addict. Any questions or comments in relation to that?
Yeah, I think I can confirm that we are not prescribing cannabis as of now, uh, because it requires to deal with certain other restrictions. And but I do resonate with the sentiment there, that it's very hard to identify pain, leave alone quantify it for someone else who's sitting outside your experience. So it is an error of judgment many times, based on so many other factors which influence that judgment.
Okay, final point from Soka today. Soka says cure question mark. It's all about treatments when you go to a doctor. Most pills in the market are meant to be taken for life. That's why only two factories produce antibiotics. Medical field not interested in a pill that gets you cured in 7 days. Two factories produce antibiotics. That doesn't sound quite right at all. Um, yeah.
I don't think that's true that only two factories are producing antibiotics, although I'm not the expert on antibiotics, but based on my experience in medical
They're
field.
widely produced.
Yeah. And,
All
and
right.
and that's also not true that if she is trying to refer to antidepressants, that they're meant to be taken for lifetime. They are not supposed to be taken for a lifetime for most of the people. It's actually rare in my experience that somebody had to be on them for more than few years at the most.
Okay. All right. So let's talk about, because again, Health City is here, not just telling you to go pop a pill. They're here to give you coping mechanisms and things that you can do. So here's again, and they provided this information, folks, some positive things you can do. So let's just run through this list because the doctor does have to go. We've got yoga, meditation, taking me time, journaling. Journaling's amazing. Listening to relaxing music, focusing on positivity, frequent exercise, eating a balanced diet, staying hydrated, going for a walk in nature, getting adequate sleep. Last week, of course, we were talking about the importance of sleep, setting healthy boundaries with those around you, speaking with someone you trust about the issues that you're dealing with, and seeking professional help. So undoubtedly, doctor, when you see patients, I'm sure your first thing isn't, oh, let me just write you a prescription. Tell us a little bit about, what it is that you do. And of course, Shamari can then tell us how people can reach out if they have any concerns about their mental health and wellness.
Well, I keep my prescription as far away from that first consult as possible. In fact, in last 1 month, I've turned away a few people who were seeking pills for some reason that they thought they need for. So usually the process is to understand the person as a whole when they come to me for the first time. It takes almost an hour and a half to 2 hours sometimes to settle down with the understanding I need to have before I can prescribe them a plan. Part of the plan could be the pills, it could be counseling and therapy, or it could be a combination of both.
Okay, very good. Shamari?
Yep. So just 640-4040 if anybody ever needs to reach out to speak to Dr. Diwakar, or you can contact us at info@healthcity.ky. And prior to us leaving, just also wanted to mention, Sandy, last week on our first day of radiotherapy, we would have treated 5 patients. And on the second day, we would have treated another 6 patients. So these are all individuals with their families that otherwise would have to travel overseas for weeks or months at a time to be able to get the cancer care needed. And now with our own radiotherapy center right here in the Cayman Islands, they no longer need to travel and incur all of those costs. They can do it right here. And yes, you still need to do your tour. So we'll set that up to make sure that you can see it from top to bottom so that people can understand this last major gap, one of the last major gaps that we're filling here in the Cayman Islands as well.
All right. So Alejandro has a question he needs some clarity on. He's saying, how can antidepressants be described lifetime when it's taken the rest of your life? So you're saying that the idea is not for it to be taken the rest of your life?
Yeah, that's what I meant, that it is not supposed to be. The plan is not to continue it for the rest of your life. You of course, coming at a point in time when you're in a crisis, and the point of medications is to tide over the crisis and give you some stability for the foreseeable future. Now, when I say that, I'm talking about most of the neurotic conditions. There are certain exceptions to what I'm saying, and certain mental illnesses that need to be kept in mind if that consideration of lifetime is being given. Like bipolar disorder would require lifetime management, Schizophrenics might require it for a long time, not lifetime still. The recommendations are not lifetime.
Mhm.
Uh, People with OCD do require it for a long, long time. But these are very few people of the total population that need to seek help.
Mhm. All right.
And
Can we
and
sneak in
Sandy,
sneak in a few more questions, Doc? I know you got to go, but we've got some
Yeah.
burning questions. Let me make them these very, very quick. This person says, waking up 3 to 4 a.m. with stressful thoughts sets me up for a day of butterflies in my belly and how to get relief from this. What about the cause and positive or negative effects of vitamins or minerals, taking extra B vitamins for the nervous anxiety? So are vitamins useful in any way? And if someone's waking up every night with stressful thoughts, that then is setting them up for, again, interrupting their life, is that someone who definitely needs to come in and maybe have a discussion about what's going on?
Yeah, I think I can speak loudly for vitamin question that
Mm-hmm.
studies do not suggest that they are going to cure your mental illnesses. If you're
Mm-hmm.
deficient on them, they might help you to be in a better physical health, and
Mm-hmm.
thereby, as a function of being in a better physical health, you might be feeling better. But it doesn't cure the mental. It doesn't make you feel better from the mental health perspective if you're not deficient on it.
Mm-hmm. Okay. And let's go ahead and give you some compliments today, Doctor. This person says, great show. I didn't know that we had Dupak Chopra working at Health City. He is knowledgeable with a soothing voice. Another person says, this doctor has exceptional command of the English language and very current with Western world terminology. So I think your voice people are finding to be very smoothing. Maybe that's why you chose the mental health area as your professional. I don't know which came first. Did you get the soothing voice first, or did that come as a, byproduct of your training?
Well, first of all, thank you for those lovely comments. I don't know whether the egg came before the chicken or this.
It's the age-old question that I think we'll never really be able to answer. But as we wrap up here, Shamari, some final thoughts.
no, I just also wanted to thank the honorable minister for calling in and
Yes.
offering her thoughts as well. That was very well placed, and we know that wellness is always key to all of her discussions and her focus, but not only physical health, right? So for her to call in and to express the fact that she's fully behind mental health, I heard the other caller come in, which is good. So the other caller called in and gave some specific points as to how they see a government being able to impact and help from a
Mm-hmm.
mental health perspective. So,
Yes.
and I know the minister is listening, so that's great, and that's why we love having this program, so that
Mhm.
we can have this type of discourse to make sure that we, as the Cayman Islands, raise all boats in order to make sure that we're as healthy as possible, both physically
Yes.
and mentally. Yes.
Thank you so much. So, thank you guys again for tuning into the program today. Hopefully, this discussion was useful. Mental Health Awareness Month. You can contact Health City if you're struggling and perhaps you need to see what options are available to you, someone to talk to who might know more information about, counseling groups that are available, counseling sessions that you can sign up for. There's lots of ways that you can cope with mental health episodes outside of medication, because I know a lot of people are adverse to medication, but the doctors have the experience and they will be able to, through their expert, sort of diagnosis, they'll be able to tell you what they recommend and what could potentially be of help and of use to you. So again, thank you very, very much, Dr. Diwakar. I still feel like I'm getting
Sharma.
the name Sharma
Sharma.
joining us, and of course Shamari Scott, who is here all the time with us here on Health City as the Chief Business Officer. Thank you guys so much. Appreciate it.
Thank you,
Thank you,
Sandy.
Sandra.
All right. Have a fantastic day. Well, folks, let's go ahead and take a commercial break, and then we're going to come back and change gears just a little bit. Good morning to Miss Dorothy. Soka says vitamins for mental health. That's a new one. Well, it's why we have the experts on here, because they can certainly address, I feel like, all of these things. There's a lot of things that are floating around, misinformation, half truths. So it's good to have the experts on the program who can get all that sorted out for us.
Are you tired of overpaying for TV services? Can't figure out VPNs? Constantly missing your favorite TV shows? And no access to the good stuff on streaming services? The frustration is real, but it doesn't have to be. Contact Roque, Cayman Streaming Pros. We'll put you back in the driver's seat in front of your TV. Call, WhatsApp, or message Roque today on 926-1213. Roque is not a TV service provider. Terms and conditions apply.
The Cold Hard Truth is Cayman's #1 talk show since it debuted in March 2020. According to independent research, we are the most listened to talk show in 2021, and most people prefer us to any other options on island. We tackle tough issues some days, and other times have fun and lighthearted discussions. But most importantly, the Cold Hard Truth is here for you. Thank you for your support as we continue to be the voice of the people in 2022 and beyond.
Folks, welcome back. Thank you guys so much for tuning in. Really, really helpful segment. You know, recently I had someone say to me, and I want to make sure that, you know, when we're talking about mental health issues, sometimes we're not always politically correct. I'm guilty of this myself, without a doubt. And I had someone recently, I'm going to identify him, but he's been on the program. You guys have heard me say that I am not a professional clinician, so I'm not diagnosing anyone, but the behavior that I see from this individual is indicative of someone who's bipolar. No two ways about it. I feel confident that if he went to a professional, that they would diagnose him with such. And, you know, at one point he was saying to me, oh, you know, you've called me bipolar on your program. And I said, but have you ever thought about going and getting a professional assessment to see whether you are or not? That's just my opinion. You can take it or leave it in terms of my opinion. He said towards the end that maybe I had a point, and that he was going to go and speak to a medical health professional to see if he could get a proper diagnosis. But one of the things I found interesting about what he said to me, and I had to really sort of correct him from my perspective, he says, well, I'm normal. And I said, what does that have to do with being bipolar? Right? So I don't want people to think because you suffer from mental health problem, whether it's depression, bipolarism, even schizophrenia, whatever, that you're not normal, right? Because some people in their head think that that's some sort of a horrible indictment on who they are. Oh, people are going to think I'm not normal. People are going to think I'm crazy. Maybe people might think those things. People are going to think those things, quite frankly, anyway, if you're exhibiting certain types of behavior. But it's only going to get worse if you're not getting the professional help that you need, right? Having depression, that is, you know, a medical condition, as far as I'm concerned. Being bipolar, that's a medical condition. We can see that there's different potential triggers and causes of it. And so I think the key really is for you to get a proper diagnosis from a professional and to seek and get the help that you need. Yes, we live in a small community. And I suppose I've always said this, even in terms of our school system, their school system really isn't equipped to deal with, for the most part, anyone who falls outside of this range of normal. And when I say this range of normal, I mean even brilliant kids who are just really, really academically smart. They excel. The system isn't equipped to deal with those people either, as well as the children who need additional care and attention because they might have a learning disability, right? So the system is really designed and built towards sort of that medium individual, the middle of the road person. And if you fall on either side of that, you're going to have struggles, especially if you don't have parents who recognize and understand where you fall on the spectrum and are able to get you the help that you need. My first exposure to someone who was bipolar was in university. And I had an opportunity to have a lot of one-on-one conversations with this individual. I worked with him at the school newspaper at the time. And the first time I kind of noticed him, though, we were walking on a track. I was walking, he was running at ridiculous speed. And I got him to slow down enough to kind of have a conversation. I was like, hey, I know you. You work he was on the production side. This is back in the day in news when you had people in the newsroom who had to cut, like literally cut and put the paper together Technology wasn't what it is today. Um, and so he was like on the production side of laying it out graphically, like how the paper, how the layout was. And he worked there and he was a student at the university just like me. And I was like, whoa, 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 the mile a minute talking fast and running around in circles. And I was like, okay, you got to slow down so I can have a conversation with you. And I remember that, as I got to talk to him a little bit more, he was very open about his mental health struggles. And, he shared with me what it's like a little bit to be in a manic phase and how, believe it or not, the time that he was most dangerous to himself wasn't in a depressive stage, which I thought was so interesting because all of us automatically assume, oh, somebody's depressed, they're more likely to be suicidal, blah, blah, blah. And he said, no, for him, his most dangerous time was in a manic phase because when he was in a manic phase, he felt like he was Superman and he felt like he could do anything. And so jumping off a building was not outside of the realm of possibilities in terms of, what he could do. And I was like, oh, okay. To me, that was like, whoa. And he's like, yeah, I feel like a superhero and I could just jump out this building right now. And the manic phase doesn't make him think if you jump out of a building, you're going to land on concrete and die. His manic stage is like, no, I can do anything. I'm going to fly. And I was like, whoa, 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 but it was an eye opener as a young adult. Like I said, that was my first experience dealing with someone who's bipolar and talking to an individual who, thankfully for me, was very, very open about his mental health struggles. He actually, on occasions, had to be institutionalized. That's how extreme his episodes were. And so the time that I saw him running around the track, I hadn't seen him at work, and he had just come out of being institutionalized for a number of weeks. I don't know whatever happened to that kid. I can't remember his name, to be honest. We move on in life. And so I just remember it being such an educational period for me. Listen, for me, university was more about the education and exposure I got to different people, different cultures. That was just as valuable or even more valuable than the piece of paper I was there to get. I don't know if you guys understand that, but it was a period of awakening for me. And I think too, because I kind of lived in a very controlled environment. My aunt was so strict, right? And I wasn't really exposed to a whole lot. University life for me was like, whoa. I mean, I just got to see a lot of people, experience a lot of different cultures. And I just took it all in from the perspective of this is an amazing learning experience. Like this is worth all the money I'm going to spend on this degree and the long nights up studying and the stress. This is going to be like life-changing forever. And so even now we are here, oh my God, is it like 20 years later since university, whatever it is? Oh, getting old, folks. I reflect on those moments and I think about how they have really impacted my life and how it shaped my life, right? And that's why it's so important. We talked about before, letting your children go out there and experience new things. Make them have friends that are Muslim. Make them have friends that are, atheists from different religions or no religions, or, expose your children to different people at the appropriate times in their lives, different cultures, how people eat differently, how they, it's just, you can't go wrong. And it doesn't change who you are, I don't think fundamentally, like you still are who you are. But I think that it can, I suppose, have, sort of life-changing, you evolve, right? You don't stay who you are forever in any event. I hope not, because that's probably not a good thing. But you really evolve. And I think that there is something to be said for that. So I reflect on my first degree in my university days, living on campus and, having these experiences as just an amazing transition into adulthood. I was ready for it. I was ripe for it. And it was just amazing. So send your kids off to university, send them far away, because Cayman is just, and I didn't even grow up in Cayman. So I think I still had more exposure than a lot of kids here would be having, but Cayman can be a very small place. And yes, it's a little piece of paradise in a way, but to even appreciate what you have here you need to go and spread your wings and go far.